Section 5. Beyond the window. Other reasons for a negative test with symptoms. While the window period is the most common reason for a negative HIV test despite early infection, there are other, albeit rarer, possibilities to consider if symptoms persist. One such factor could be related to the specific type of HIV. There are two main types of HIV, HIV-1 and HIV-2. Most HIV tests are designed to detect HIV-1, which is the most common type worldwide. Some tests also detect HIV-2, but if a test is specific only to HIV-1 and a person has contracted the less common HIV-2, the result might be negative. This is more of a concern in regions where HIV-2 is more prevalent, such as West Africa. Another very rare scenario involves individuals who have an atypical immune response to HIV. Some people, sometimes referred to as elite controllers or those with specific genetic factors, might control the virus exceptionally well, leading to very low viral loads or delayed antibody production. In such extremely rare cases, standard tests might take longer to become positive or could, in theory, be more challenging to interpret. However, this is not a common occurrence and modern tests are very sensitive. It's a possibility that medical professionals might consider in complex diagnostic cases but not a primary explanation for most. One of the primary reasons you might experience HIV-like symptoms despite a negative HIV test is that many other common illnesses share a similar initial presentation. Influenza, commonly known as the flu, is a prime example. The flu is a viral respiratory illness that can cause fever, chills, muscle aches, fatigue, sore throat, and headache. All symptoms that can also occur during acute HIV infection. Given that flu season occurs annually and affects many people, it is a very plausible alternative diagnosis if your HIV test is negative. Another common culprit is infectious mononucleosis, often called mono or the kissing disease. Mono is typically caused by the Epstein-Barr virus, EBV, and its classic symptoms include extreme fatigue, fever, sore throat, and swollen lymph nodes, particularly in the neck. These symptoms can be quite severe and can last for several weeks, closely mirroring the symptom profile of acute retroviral syndrome. Many young adults and adolescents contract mono, and it can easily be confused with early HIV if there's a background of concern about HIV exposure. Strep throat, a bacterial infection caused by Streptococcus pyogenes, can also cause a severe sore throat, fever, and sometimes a rash or body aches. While swollen lymph nodes are common, the overall symptom complex can overlap with early HIV.